Bismillahir Rahmanir Rahim. Every night in Ramadan, Allah chooses people to be saved from the hellfire. I'm Dr. Taimia Ayub, and today I will be presenting the topic of health technologies, global and national perspective, under the supervision of Professor Dr. Saira Afzal, my supervisor and Dean, Institute of Public Health, Lahore. This is the outline of today's presentation. We will start with defining what are health technologies, what is the global current condition, digital health and e-health, medical devices and diagnostic. Then we will slightly cover health information system, and then Pakistan's perspective, policy and ethics, and what is the way forward. And in the end, we will do multiple choice questions. So let's start with the concept of health technologies. Health technologies encompass a broad spectrum of tools used to promote, prevent, diagnose, treat, monitor, and manage health conditions at both individual and population level. These include medical devices, diagnostic and pharmaceutical, digital health systems, software as a medical device, artificial intelligence, telemedicine platform, health information system, wearable devices, and enabling infrastructure such as cloud computing and connectivity networks. In modern public health system, health technologies functions not merely as clinical tools but as systemic enablers of surveillance, service delivery, optimization, quality improvement, health financing efficiency, and governance transparency. This strategic integration determines whether a health system can respond effectively to emerging diseases, manage chronic conditions, and achieve universal health coverage. Health technologies as WHO's health system building blocks. So these are the six building blocks of WHO as we know, which include leadership and governance, health workforce, health information system, medical products, vaccines and technology, health financing, and service delivery. So, according to World Health Organization, the application of organized knowledge and skills in the form of devices, medicines, vaccine procedures, and systems developed to solve a health problem and improve quality of life is health technology. So, it can include medical devices like diagnostic tools, surgical equipment, implants, prosthetics, wearable devices. Then it can have medicines and vaccines, pharmaceuticals, biologicals, immunizations, gene therapies. Then health information, which can include EHR, HIS, telemedicine platform, decision support systems. And finally, procedures and systems like clinical protocols, health service delivery models, and AI algorithm. So, global health technology landscape currently about global digital health market is expected to increase about $665 billion and about 7.5 billion plus mobile subscription which will be using mHealth. 49% of the countries with are with national e-health strategies, and about 45 billion dollars are expected to be invested in global AI in healthcare by 2026. And the key global trends currently are the shifting from hospital centric to patient centric care model, explosion of AI driven diagnostics, especially in radiology, pathology, and genomics, pandemic driven telemedicine adoption after COVID 19, which accelerated it, rise of precision medicine by genomics and pharmacogenomics, global digital health equity gap, high income versus lower middle income countries, integration of social determinants into health technology design. Importance of health technologies in public health systems. Health technologies contribute to the health system performance through multiple mechanisms. For example, it can lead to quality improvement, evidence based diagnostic and decision support system, reduce clinical errors and variability in care. Timeliness, point of care diagnostic and telemedicine reduces delay in diagnosis and treatment. Then equity, remote care platform extends services to geographically underserved population. Efficiency, digital system reduce duplication, streamline workflows, and enhance resource allocation. Accountability, Electronic data system improve traceability and performance monitoring. And finally, resilience. Surveillance technology and laboratory networks strengthen pandemic and post-pandemic response in cases of uh, global health emergencies. Classification and taxonomy of health technologies. Health technologies can be classified along functional and regulatory dimensions. For example, A, clinical and diagnostic technologies, which include imaging systems like CT, MRI, ultrasound, then laboratory analyzers and point of care diagnostics. B, we have digital health system, which include electronic health records, laboratory information system, district health information software, and national registries. C, software as medical devices, which include clinical decision support system, AI-based risk prediction model. D, telehealth and remote monitoring, which include virtual consultations, remote vital sign monitoring. E, enabling infrastructure, cloud computing, interoperability frameworks, and cybersecurity system. Regulatory oversight increases as clinical risk increases, particularly for software as medical device and AI driven systems that directly influence diagnosis or treatment. For medical devices and diagnostics, this is the WHO device classification. We have class A devices which are low risk, like bandages and thermometer. Then we have class B, which includes low to moderate risk, syringes and endoscope. Then we have class C with moderate to high risk, like ventilators and dialysis. And then we have class D with very high risk, which includes pacemakers, HIV tests, and so on. So, medical devices and diagnostics. Number one, we have point of care testing, which is rapid antigen test for COVID, malaria, typhoid, portable glucometers, HbA1c meters, gene expert for TB deploy, which is being deployed widely in Pakistan, handheld ultrasound. Then we have wearable technologies like smartwatches for calculating heart rate, SpO, oxygen saturation, and ECG, continuous glucose monitors, remote patient monitoring patches, fitness trackers, preventive health applications. And then we have advanced imaging like AI powered radiology, chest x ray interpretation by the help of artificial intelligence, MRI, CT, PET scan innovations, low cost portable x rays for rural, lower middle income countries. For example, in Pakistan, um, PIMS, there are different ways which are being employed to increase the imaging capacity. Now we come to digital health and e-health. In this category, we have first of all telemedicine, which includes remote consultation via video or phone, asynchronous store and forward, specialist referral without traveling. According to WHO, 80 plus countries have telemedicine policies. In Pakistan, Sehat Kahani and One Docway and other such telemedicine services are being very active. Then we have on the second number M Health or mobile health, which include SMS health reminders and MNCH messages, mobile apps for chronic disease management, community health worker digital tools, and 3.7 billion unique mobile users in lower middle income countries. So there is a very big market for use of mobile health and using it productively. Even the simplest things like SMS health reminders can be used if effectively can lead to a very big impact. For example, in Pakistan, lady health workers are starting to use DHIS2 mobile applications. Then we have artificial intelligence, which includes diagnostic imaging like chest x ray AI, predictive analytics for outbreak detection, clinical decision support systems, drug discovery acceleration, and for example, Google DeepMind and different softwares or for artificial intelligence are being used. Finally, we have big data and analytics, which includes real time disease surveillance, population health management, claims data for policy decisions, genomic data for personalized cares. For example, Pakistan has rolled out DHIS2 and it can lead to big data collection, which can help in predictions and analytics. Then we have category of health information system. in which there is electronic health records, which include digitized patient records, continuity of care, reduced medical errors, for example, Open MRS or DHIS2 tracker in Pakistan. Then Health Management Information System or HMIS, routine health data aggregation. DHIS2 has been adopted by 80 plus countries, including Pakistan, and facility to national data pipeline. Then we have laboratory information system, which automated test results reporting, reduces turnaround time, integrated with EHR platform, and TB lab networks in Pakistan are using it. Similarly, bigger laboratories like Chughtai Laboratory and Shaukat Khanam, they are also using these information systems. Pharmacy and supply chains. Quantification and forecasting, reduce stockouts of essential medicines. Electronic LMIS in Pakistan is being used, and which can help in predicting when the stockout is reduced and when are the medicines running out. Then we have disease surveillance system, which includes IDSR, integrated disease surveillance, outbreak alert system, EWON, COVID-19 Pakistan NCOC dashboard is another good example for disease surveillance system, and WHO IHR compliance and reporting. Then we have National Health Data Warehouse, which aggregate all HIS data sources, policy, analytics, and planning tool, interoperability via FHIR or HL7. Pakistan is not currently having any national health data warehouse, but there are plans to make a warehouse which will include all the resources of information and data which is scattered currently around the provinces and district level. So, according to health technology landscape for Pakistan, there are about the population is 220 million, more than 220 million, which is the fifth largest population in the whole world, and the doctor to patient ratio is very less. And 71% there is mobile phone penetration in which is more prominent in urban areas than in rural areas, but similarly, but still the usage of mobile phones is increasing day by day, and 35% of the those users have internet connections, which is about 74 million, more than 74 million, but still there is need to increase the internet users so the people can benefit more from the technology. So the key national digital health initiative which are being currently going on or there are expanding include DHIS2, which is the national HMIS system deployed by the NHSRC across all provinces, facility level data reporting for maternal and child health, immunization and disease surveillance. This is currently active. Then we have Sehat Kahani platform, Pakistan's first telemedicine platform providing e-consultation to women, expanded to rural areas. About 20,000 plus consultations are being given per month. This is again active. Then we had COVID-19 NCOC system, National Commands and Operations System, real-time dashboard, contact tracing app, which was called Rabta, and vaccination tracking through Nadra and Sehat Kahani, which was a landmark initiative. And I think we have all been through that website and NCOC website, and we all saw the trends which were being predicted or the waves of COVID-19 cases which were being shown in that. So it was NCOC website was a landmark and a historic innovation and way forward for Pakistan during COVID-19. Then we have Pakistan Immunization Info System, digital immunization registry linked to Nadra for unique ID tracking, piloted in Khyber Pakhtunkhwa and Punjab districts. It is a currently going on project and it is expanding. So there are few challenges which have been in Pakistan regarding technology, particularly health technology adoption. These include infrastructure, like low internet connectivity in rural areas, less than 10% in Balochistan and Fata areas, unreliable power supply, limited limits device usage, inadequate health facility IT structures. Then we have human resource, the challenge regarding human resource, critical shortage of health informatic professionals, low digital literacy among healthcare workers, brain drain of trained IT and medical professionals. Then governance and policy, fragmented digital health policy across provinces, no comprehensive national digital health act yet, weak regulatory capacity for medical devices like DRAP is trying to manage it, but it is a whole new level of uh, regulatory, sorry, regulatory body is needed for these devices. Financial constraint, only 2.8% of GDP. Currently, Pakistan is actually spending 2.8 was the highest in our history, but currently we are only spending only 0.9% of the GDP on health, which is very low. Even from our own perspective, few years back we were spending about 2% GDP. So there is need to spend more money on health. High device import duties limits technology access, then donor dependent digital health projects lack sustainability. This is an again important issue. Data privacy and security, no dedicated health data protection law, cybersecurity vulnerabilities in health system, low public health trust in digital health data sharing. Then we have health equity. Urban rural digital divide deepens health inequities. Gender gap in mobile phone ownership. Women have 38% less mobile ownership as compared to men. Disability access not considered in platform designing. So, this is a figure showing global evidence and from Pakistan regarding countries with telemedicine policy by income group, and as you can see the higher income countries which already have enough resources are more active in telemedicine policy, and low middle income countries and low income countries which need innovations like telemedicine to cater large number of population, they are having less active role in telemedicine and policy development and its implementation. So again, we have in Pakistan, Sehat Kahani is the bigger success story for women doctor consultation, and it has about 500K plus users. And then there is another one doc way, which is 24/7 teleconsultation platform. Then we have Shifa for You, doctor's appointment and EHR. Then there is DOC or doc, digital health and pharmacy. Then there is Dastan for mental health teletherapy, and there are also government initiative piloting tele OPD in DHQs. During COVID-19, telemedicine visits increased by 3,800% globally between January to April 2020. Pakistan recorded significant surge in app-based consultation during lockdowns, a policy opportunity not yet fully institutionalized. Artificial intelligence in healthcare. This is again another aspect of health technologies. Artificial intelligence can be used for diagnostics and imaging. Pakistan is using some X-rays for AI tool, but mostly Pakistan Radiology Society is also exploring AI integration options. But currently, these AI and X-ray tools are mainly used for research purposes or for seeing feasibility, but there has not been widespread use of these. Then there is use of AI for drug technology, drug discovery, which is more prevalent in international platform. For example, AlphaFold from DeepMind predicted 200 million plus protein structures, and COVID-19 vaccine development was accelerated by using AI. In Pakistan, ComSets and NUST research on computational drug designs, but it is still in exploratory stages. Then we have disease surveillance. Blue Dot AI predicted COVID-19 spread before WHO alert. and WHO IP information system using ML. In Pakistan, FELTP uses basic analytics. No dedicated AI surveillance platform has yet been developed, which is a very big major gap to be filled. Similarly, for clinical decision support, there are internationally there are quite a few platforms which are being used, which are reducing medication error by 55%, according to a study published in the JAMA. In Pakistan, AKUH and Shifa are piloting clinical decision tools, and but it's still in the piloting stages and need bigger level integration. So, after the important usage in which artificial intelligence is helping us, there are few ethics and governance issues of artificial intelligence in health. According to World Health Organization, six ethical principles for AI in health are important. Number one, protect autonomy and human rights. Number two, promote human well being and safety. Three, ensure transparency and explainability. Four, foster accountability and responsibility. Five, promote inclusiveness and equity. Six, ensure sustainability and environmental responsibility. Public health professionals must ensure AI systems are validated across demographic subgroups, monitored for bias, and subject to clear accountability structures. Now we come to policy regulation and ethics in general health technologies. For this, we have global framework which includes global WHO Global Strategy on Digital Health 2020 to 2025. Then we have FDA Digital Health Center for Excellence in United States. Then we have European Medical Device Regulation MDR 2021. Then we have European Union AI Act, High Risk AI in Healthcare. WHO Good Regulatory Practice for Medical Devices, IHR 2005 Electronic Surveillance Reporting, ISO 13485 for Quality Management for Medical Devices, and finally HL7 FHIR for Health Data Interoperability Standards. For Pakistan policy landscape, we have Drug Regulatory Authority Pakistan (DRAP) device regulation in 2012, then National Digital Health Vision in 2009, and National Health Vision from 2016 to 2025. Pakistan Telecommunication Authority (PTA) Digital Governance, Prevention of Electronic Crimes Act in 2016. 18th Amendment devolved health responsibility more on the putting it more on the provinces. No dedicated health data protection law yet. Punjab Health Sector Reform Initiative is also there. Several ethical considerations which should be done include algorithmic bias, AI trained on non-representative data, data sovereignty, who owns patient data, informed consent in digital health context, then equity, tech widening health gap for poor or reducing it. This is another important point to be considered. Privacy versus public health surveillance tension, accountability when AI diagnostic is wrong, commercialization versus public good in health tech, impact on patient provider relationship. So, among the few strategic frameworks which I named, I will explain few which are very important in context of health technologies. Uh, so, first of all, we have Global Strategic Framework, WHO Global Strategy on Digital Health 2020 to 2025. The WHO Global Strategy on Digital Health provides a roadmap for countries to integrate digital technologies into health systems. It emphasizes national digital health strategy aligned with health system, strengthened governance and regulatory oversight, interoperability and standardized architecture, digital literacy and workforce capacity building, sustainable financing model, monitoring and evaluation frameworks. Then we have WHO Smart Guidelines and Digital Adaptation Kits, DACs. Smart standards based, machine readable, adaptive, requirement based, and testable guidelines aim to translate WHO normative guidance into digital ready format. It includes convert clinical recommendation into structured workflows, define required data elements, provide interoperability specification, align with standards such as HL7 FHIR. So now we have some success stories around the world and from in Pakistan, particularly about using health technologies for the good of the people. In Rwanda, drone blood delivery were done with via zipline. Zipline operates drone delivery of blood and medicine to 40 plus hospitals in Rwanda. Reduce blood wastage by 67%, delivery time cut from 4 hours to 30 minutes. Then we have in India example of Ayushman Bharat Digital Mission, which is working for 1.4 billion citizens, integrates hospitals, labs, pharmacies on one platform. In Pakistan, we had NCOC COVID 19 digital response. As I told you before, real time dashboard integrating data from 36 districts. Rabta contact tracing app was also linked to it, and Nadra linked vaccination record system, Sehat, was also used. There was international recognition for data driven response. And finally, we have lady health workers and M Health. 100,000 lady health workers equipped with Android tablets loaded with DHIS2 mobile, real time reporting of MNCH indicator, antenatal visit tracking, EPI coverage, reporting it, and so on. Significant improvement in data completeness in KPK and Punjab districts. Then there is another important topic of health technology assessment, which is a systematic evaluation of properties, effects, and impacts of health technologies to inform policy decisions about their adoption. It includes clinical efficiency, efficacy and effectiveness, safety profile, cost effectiveness, equity and ethical impact, organizational and social impact. So, for health technology is a systematic evaluation of properties, effects, and impacts of health technologies to inform policy decisions about their adoption. In Pakistan, it is there is no formal HTA institution yet. DRAB is responsible for device approval. Limited HTA processes are there. Pharmaceutical HTA initiated under National Essential Medicine Policy. AKU and HEC affiliated centers building a health economics capacity. And whereas in the world globally, there are in UK there is NICE, which is the gold standard for HTA for NHS adoption decision. And similarly for Canada, Germany, every country has their own decision for uh, health technology assessment. So, forward for Pakistan is to establish a national HTA institution, enact health data protection law, strengthen DRAB medical device division, invest in health informatics workforce, scale interoperable DHIS2 platform, public-private partnership framework should be more developed. So, health technologies are not just tools, they are determinants of health. Technology adoption must be equity centered or it will deepen existing disparities. Pakistan is at critical inflection point. Infrastructure and political will needs alignment. Public health professionals are the essential bridge between technology and health outcome. And in that, I would like to just say that the question is no longer whether to adopt health technologies, but how to adopt them wisely, equitably, and sustainably. Now we come to multiple choice portion of the MCQs. So we have first MCQ, a district health officer introduces health ultrasound device for use in rural outreach clinic to improve antenatal screening coverage. This initiative best reflects which public health functions of health technologies. A. Increasing accountability through performance monitoring. B. Enhancing timeliness by reducing diagnostic delay. C. Strengthening governance through digital regulation. D. Improving financing through cost recovery model. Or E. Supporting interoperability between health facilities.
B.
Yes, yes, it is B. Enhance timeliness by reducing. A hospital adopts an AI-based chest X-ray interpretation tool that directly assists clinicians in diagnosing tuberculosis. From a regulatory perspective, this technology would most appropriately be categorized as enabling infrastructure supporting cloud-based analytics, software as medical device influencing treatment decisions, health information system for data storage, telehealth platform enabling virtual consultation, or e-clinical protocol for service delivery optimization.
B.
B.
Yes, it is B, software as medical device. A national health program implements DHIS to enable facility level maternal and child health reporting across provinces. This intervention primarily contributes to which health system strengthening objective? Enhancing supply chain forecasting of essential medicines, improving surveillance through structured routine data flow, increasing diagnostic precision via AI enabled imaging, D. Expanding teleconsultation services in remote regions, or E. Standardizing surgical care pathways nationwide.
B.
B.
Yes, B. A provincial health department launches teleconsultation services to provide specialist advice to patients in remote mountainous region without requiring travel. Which principles of health technology's impact is most clearly demonstrated? Efficiency through reduction in workflow duplication, resilience through pandemic preparedness, equity through improved geographic access, accountability through digital monitoring, or sustainability through a reduced environmental burden.
C.
D.
Yes, it is C. A policymaker is evaluating whether to introduce a new AI based clinical decision support tool nationwide. The most important appropriate framework to systematically assess its clinical effectiveness, safety, cost, and equity implication would be Health Information Exchange Architecture, WHO Smart Implementation Guideline, interoperability standards such as HL7 FHIR, Health Technology Assessment Approach, or integrated disease surveillance response system.
D.
Yes,
E.
it is D, health technology assessment. A lady health worker equipment tablets to report antenatal visits and immunization coverage in real time are functioning primarily as digital governance regulators, agents of frontline digital transformation, developers of AI based predictive tools, or financial managers of health programs, or e designers of interoperability protocols.
A.
No, it is
B.
B. Agents of frontline digital transformation. Then we have National Digital Health Identity Platform integrates hospital, laboratories, and pharmacies into a unified system using unique patient identifier. This intervention most directly supports pandemic outbreak detection, workforce capacity development, precision community implementation, telemedicine service delivery, or continuity of care across providers.
B.
Um, it is E, continuity of care across providers, because it is integrated hospital, laboratories, and pharmacies into a unified system. A country rapidly scaled digital dashboards and contact tracing apps during a pandemic, but struggled to sustain these tools afterward. This experience most strongly supports which lesson? Crisis driven innovation requires post crisis institutionalization. Telemedicine eliminates need for health workforce. Digital tools reduce ethical concerns in surveillance. AI system replace traditional public health planning, or infrastructure constraints are irrelevant during emergencies.
A.
A.
Yes, it is A. This is the answer key of the MCQs. This is the YouTube channel where this video will be uploaded. And thank you very much for listening.